Hi, my name is Skylar, and I chose to do a myofascial massage and a sound bath for my two CAM therapies. A myofascial massage is a deep tissue massage that focuses specifically on the patient's fascia, and a sound bath is a meditative experience that uses wind chimes and sound bowls and other instruments to promote a vibrational energy to meditate to. I have really achy hips and knees, and compression socks don't always help with that. And I also suffer chronic migraines, so I felt like myofascial deep tissue massage would be a good therapy for me to try. One of my SMART goals for my massage was I will acknowledge my feelings of discomfort and express them so I can promote a relaxing and holistic experience for myself. And that goal was definitely met based on the experience that I had. It was very soothing and very relaxing. We talked in hushed tones. My massage therapist knew who I was when I got there. They called me by name. Tea lights only. There are no overhead lights used. And the massage therapist used her whole body to massage my whole body, which was like an experience I'd never had before. And I could definitely tell that there was a difference between this type of massage and like a typical maybe head, shoulders, neck massage that I've gotten in the past. I think that this therapy would be very beneficial, especially for patients who are in bed for prolonged periods of time and have very stiff joints and muscles. In the ICU, part of my job is to do like active or passive range of motion with my patients when they're like intubated, sedated. And I can see this therapy being utilized. Maybe not with like a 1 hour fancy massage, but foam rollers and massage guns also count towards this type of therapy. I think we could bring some of that in and we could try deep tissue massaging our patients. Evidence I found for deep tissue massage involves less rigid muscles and harmony between a patient's myofascial systems, increased flexibility and reduced pain, and increased joint motion. I decided to try a sound bath because I love to do yoga, but I really struggle with the breathwork aspect of it. So I thought that maybe just trying just breathwork would help me focus. We were in an intimate group setting and we used yoga mats, bolsters, pillows, blankets, anything you wanted to feel comfortable. The instructor led us through some guided imagery and then started using the sound bowls and then the various other instruments that she had to kind of channel our meditation. I'm not gonna lie, it was a little bit jarring. The sound bowls were much louder than I anticipated, and it kind of sounded like a tornado siren. So I spent the first 15 minutes of class kind of in like fight or flight, and I really, really had to focus on finding my breath and then staying in my breath. So it was a very good exercise in that sense, but I think I'll have to try better next time. I will say that the two other members in my class did end up snoring by the middle of it, so I do think that there's like lots of benefits to this type of therapy. Sound therapy really does work, and I do think that this could be something that we could easily incorporate in for our patients. When I'm at work, I do like to find out what type of music that they like to listen to, and then I'll play that for them, like while I'm doing their bath or like wound care or anything. And I've seen it help in bouts of kind of extreme anxiety. It just kind of helps to relax the patient and soothe their mind. There was actually a study that was done that proved that singing sound bowls had a positive effect on decreasing anxiety in patients waiting for an angiography. So there is proof that this works. Thanks so much for listening.